Have you ever heard of autoimmune diseases? You may know someone with rheumatoid arthritis, lupus, or type 1 diabetes, but did you know that these conditions all have one thing in common? They are caused by the immune system mistakenly attacking the body's own healthy cells. Autoimmune diseases affect millions of people worldwide, causing chronic pain, inflammation, and organ damage. In this video, we will explain everything you need to know, including what autoimmune diseases are and why they happen, who is most at risk, the symptoms to watch for, how doctors diagnose these conditions, the best treatment options available today, alternative therapies and new breakthroughs in medicine, lifestyle changes that can help manage symptoms. This is a must-watch video for anyone looking to better understand autoimmune diseases, whether for themselves or a loved one. The immune system is designed to protect us from infections and diseases. Think of it as the body's defense system, like an army fighting off harmful invaders such as bacteria, viruses, and toxins. But in autoimmune diseases, the immune system loses its ability to tell the difference between harmful invaders and the body's own healthy cells. As a result, it attacks normal cells and tissues, leading to chronic inflammation, pain, and tissue damage. This can affect various organs, joints, skin, and even the nervous system, depending on the type of autoimmune disease. There are over 80 types of autoimmune diseases, but we will cover some of the most common ones. Here's a closer look at some of the most well-known autoimmune diseases. 1. Rheumatoid arthritis affects joints, causing pain, swelling, stiffness, and deformities. It can also impact the heart, lungs, and eyes, often worsens over time if left untreated. 2. Lupus affects multiple organs, including the skin, kidneys, heart, and brain. It can cause joint pain, extreme fatigue, facial rashes, and organ failure. 3. Multiple sclerosis attacks the nervous system, affecting the brain and spinal cord, can lead to vision problems, muscle weakness, and difficulty walking. 4. Type 1 diabetes. The immune system destroys insulin-producing cells in the pancreas. Without insulin, blood sugar levels become dangerously high, requiring lifelong insulin therapy. 5. Psoriasis and psoriatic arthritis. Psoriasis causes red, scaly skin patches due to immune overactivity. Psoriatic arthritis causes joint inflammation and pain. 6. Inflammatory bowel disease includes Crohn's disease and ulcerative colitis, which cause chronic inflammation of the digestive tract, leads to severe abdominal pain, diarrhea, weight loss, and malnutrition. 7. Thyroid autoimmune diseases. Hashimoto's thyroiditis. The immune system attacks the thyroid, causing fatigue, weight gain, and depression. Graves' disease causes the thyroid to be overactive, leading to weight loss, rapid heartbeat, and anxiety. 8. Myasthenia gravis. The immune system disrupts nerve-muscle communication, leading to muscle weakness, fatigue, and difficulty breathing. These diseases can affect anyone, but who is most at risk? Who is at risk for autoimmune diseases? Well, several factors increase the risk of developing an autoimmune disease, including genetics. If a family member has an autoimmune disease, you may be at a higher risk. Infections and viruses. Certain infections, like Epstein-Barr virus, have been linked to triggering autoimmune diseases. Environmental factors. Pollution, toxins, smoking, and processed foods can all contribute to inflammation. Gender and hormones. Women are more likely to develop autoimmune diseases than men. How are autoimmune diseases diagnosed? Doctors use several tests to diagnose autoimmune diseases, including anti-nuclear antibody test, which checks for immune system activity, C-reactive protein and ESR, which measure inflammation levels, rheumatoid factor and anti-CCP test, which help diagnose rheumatoid arthritis, thyroid antibody tests, which identify Hashimoto's and Graves' disease, and MRI and CT scans, which detect nerve damage in multiple sclerosis. Best treatments for autoimmune diseases. Although there is no cure, treatments can control symptoms and prevent damage. Immunosuppressants like methotrexate and azathioprine reduce immune system attacks. Corticosteroids such as prednisone are powerful anti-inflammatory drugs. Biologic drugs like Humira, Remicade, and Stelara target specific immune responses. JAK inhibitors, new drugs like Rinvoq, help control inflammation in rheumatoid arthritis, inflammatory bowel disease, and lupus. And insulin therapy is used for type 1 diabetes. Remember, these treatments should only be used under the guidance of a doctor. What works for one person may not be safe or effective for another. If you experience symptoms, always consult a healthcare professional before starting or stopping any medication. Alternative therapies and lifestyle changes. An anti-inflammatory diet, which includes more fruits, vegetables, and omega-3s. Regular exercise to improve joint flexibility and mobility. Stress management techniques like meditation, yoga, and deep breathing, and quality sleep, which helps regulate the immune system. Autoimmune diseases are complex but manageable. If you or a loved one has symptoms, don't ignore them. Early diagnosis is key. What questions do you have? Leave them in the comments. Hit the like button if you found this valuable, and don't forget to subscribe for more.